And we're just going to go straight into our first speaker of today, who is going to be talking about race, ethnicity, and criminal justice system on the health and well-being of Black people. He is Dez Brown, the CEO of Greenleaf Trust and founder and director of Spark to Life, a community-inspired initiative that empowers and advocates for offenders and those at risk of offending. Dez is a qualified person-centered therapist and ordained minister and has served as a prison chaplain. He is a gifted communicator and regularly delivers training and bespoke sessions at conferences, events in prisons in the UK. Dez is one of 2 appointed BME specialists for the CLIN's Third Sector Advisory Board for Reducing Reoffending that advises the government on issues to do with prison and probation. Wow. Over to you, Dez.
Okay, good morning, everybody. It's a great pleasure to be joining this conference this morning. I'm going to share my screen. I've got a lot of slides, but I'll whistle stop through them all, and I'll make the slides available afterwards via the people that are running the conference. So here we go. Hopefully everybody can see that. If you can't, I'm sure the host will let me know. So just looking, as it's already been mentioned, at race and ethnicity within the criminal justice system, specifically at the health and well-being of BAME people, especially Black people. One of the things I want to kind of mention is that I acknowledge that the term BAME can be problematic as it refers to a group of people who are far from homogenous. But the intersection of race, ethnicity, faith, and culture makes social identities multifaceted and shifting. So the experiences of individuals within these groups will vary. Wherever possible, I seek to be specific when describing groups of people, but at times use the term BAME, albeit reluctantly, to describe inequality and discrimination across the groups when necessary. I've already been introduced, so I won't go into any of that. The only thing I would add is that I done my placement as a therapist in Pentonville prison, which was quite helpful. So obviously when we come to a conference and someone speaks or we share, we'll come with a worldview. And Steve Covey said, we see the world the way that we are, not the way that it is. And there's a concept within therapy called phenomenology, which is the philosophy stroke theory of our experience and our consciousness. So we all have a phenomenology, we all have a worldview, and the worldview is based on the way we are, not the way that it is. So people's experiences are really important. In July 2016, Theresa May said, if you're Black, you're treated more harshly by the criminal justice system than if you're white. So it's been acknowledged within high government level, within the Prime Minister at the time, that obviously Black people are treated different. So what do we know about the criminal justice system? There's been successive reviews in the criminal justice system over many years looking at the treatment and the outcomes for Black, Asian, minority ethnic people. And they've demonstrated the disproportionality that our community face and individuals in the system, the poor outcomes that they face. So there's a Lord Bradley's review 2009, which looks specifically at disproportionality and mental health within the criminal justice system. Also, we've got the Young Review, the Taylor Review, and the Lamb Review. And these, again, can all be accessed online. When, for instance, we're looking at examples of emerging findings published by the Lamb Review in 2016, it pinpointed specific stages of the criminal justice system at which disproportionality occurs. So young Black males, for instance, are 3 times more likely to be arrested, 10.5 times more likely to be arrested for robbery than young white males. Black, Asian, minority ethnic people are more likely to be convicted at magistrates court, have their case sent to Crown Court and be sent to prison from Crown Court. For every 100 white women given custodial sentences for drug offences, 227 Black women are sentenced to custody for the same offence. And once in prison, BAME men are 50% more likely to have adjudications brought against them. So when we're looking at mental health and the intersection of the criminal justice system and mental health, there was a joint briefing done by NACRO, CLINCS, the Race Equality Foundation, and the Association of Mental Health Providers in August 2017 called Moving Forward. And what it found was, and it's, again, you can get this online, it's worth a read. It says people from Black, Asian, minority and ethnic groups are disproportionately represented at all stages of the criminal justice system. And it says the Equality and Human Rights Commission has stated that there is greater disproportionality in the number of Black people in prisons in the UK than in the United States, which may raise some eyebrows. Additionally, research studies and data monitoring have consistently shown that those from Black communities, in particular, all those overrepresented across mental health services. So this anomaly is compounded by the fact that both systems seriously disadvantage Black people. So studies also highlight that different ethnic groups have different rates and experiences of mental health problems, which reflect their different culture. And I think this is important for us to understand: cultural and socio-economic context and access to culturally appropriate services. So when we talked, or when I introduced at the beginning about being Black, Asian, minority, ethnic, when you begin to break that down, because we're not a homogenous group, you begin to see that there are differences within people's ethnicity, different cultural experiences. So for example, African Caribbean people living in the UK have lower rates of common mental health disorders, but are 3 to 5 times more likely to be diagnosed with and admitted to hospital for schizophrenia. So in general, people from BAME groups living in the UK are more likely to be diagnosed with mental health problems, more likely to be diagnosed and admitted to hospital, more likely to experience a poor outcome from treatment, and more likely to disengage from mainstream mental health services, leading to social exclusion, deterioration in the mental health. Probably much of what I'm sharing people will know, but I think it's good at the beginning of the conference to contextualize what a lot of the speakers are probably going to be building on, which is there is clear evidence and data to support the disproportionality and in many ways the injustices that are experienced by people of colour within the criminal justice system. So they, in their research, the reasons for the disparity will include, and this is a few things: the impact of migration, including trauma in country of origin. I'll be talking a lot about trauma in a moment. The complications in navigating the migration process and hostile responses in the host country. So people coming over to the UK, the United Kingdom and Britain, and just the trauma of the migration and the journey, but then experiencing levels of hostility. There's material and socio-economic disadvantage, including reduced access to employment and housing, again, can compound the stresses and pressures around someone's mental health and mental well-being, and the experience of racism and or exclusion. So the Bradley Review reviewed people with mental health problems or learning disabilities in the criminal justice system, found that people from BAME communities are 40% more likely than white Britons to access mental health services via a criminal justice gateway. So their findings and their concerns and their recommendations, and there's over 16 recommendations that was given to the government, how they can address the issues of mental health within the criminal justice system. So discrimination and differences underpin the negative experiences of people from BAME communities across the criminal justice system and mental health services. Although further measures need to be taken to address disadvantages and discrimination, the following recommendations focus specifically on actions to address disproportionality in health in the justice system. They are grouped in 4 areas. They need appropriate services, services that are person-centered, that are culturally competent and that are relevant to the service users. Data, there isn't enough data out there to be able to best serve the service users that we're trying to reach. And so they need to be intentional about collecting the data, specifically around whether it's Black people from African or Caribbean backgrounds, whether it's dealing with Asian people, etc. The workforce and training is really important, whether it's training around unconscious bias, whether it's training around understanding the impact of trauma, etc. That needs to happen across the workforce. Involving people with lived experience is a non-negotiable. Often it's being done too, and they're not involved in the actual planning and the outworking of services. And there needs to be integrated working. So the voluntary sector needs to be central at helping deliver these services and shaping these services for the client group, because more often than not, the voluntary sector is the community, part of the community, and we'll have people with lived experience serving within the program stroke charity. So I'm looking now specifically at bridging the gap in health and inequalities of BAME communities within the mental health and social care settings, which is really the title of today's conference. So I've taken it from a concept called ABC of ACEs, and ACEs stands for Adverse Childhood Experiences. But you and I know that, albeit we can look at children, and a lot of our service delivery is with young people within the criminal justice system, or young people that are disenfranchised from mainstream society. We work with medium to high risk offenders, and we look at the ABC of ACEs, which is A's to accept that everybody has experienced trauma. And trauma is a deeply distressing or disturbing experience. Let me just reiterate that, a deeply distressing or disturbing experience. So someone's phenomenology, which is their worldview based on their experience that affects their conscience and their consciousness. If someone's gone through a traumatic experience, it will affect my worldview and my consciousness. So I will be more, the way that I filter things or interact with services will be affected by my experiences. But we have to accept that everybody has experienced a deeply distressing or disturbing experience at some point in their life. Once it becomes around issues of engaging the criminal justice system or engaging the NHS around mental health, and it's traumatic, they will then have a voice to speak into that. And this in turn will become the behavior. It will affect their behavior. And I think us as professionals, what we need to be mindful of is we need to be curious. We need to be asking, again, relevant questions, because I need to and I want to understand. And that's where our empathic approach comes in. So the ABC of ACEs. So we need to stop pathologizing, which is looking at a group of people and thinking, are they psychologically abnormal? And what I mean by that is when you look at colonialism, when you look at institutional racism, and you look at slavery historically, it was built on saying that people of color were psychologically or physically different and abnormal and was not fully human. And we've got to be very careful that when we start looking at disproportionality and numbers that are high, that we can challenge the system and say it's because of systemic racism, it's because of inequalities, and it's not because there is something different with people of color, for argument's sake. So this enables us to ask, what has happened to you? I think one of the big approaches with a trauma-informed approach that is different from a medical approach will look at your symptoms and try and medicate them. A trauma-informed approach will look at your symptoms and not seek to initially medicate them, but to ask the question, what has happened to you? Why are, you are presenting a certain way because something's happened. There isn't something wrong with you, something's gone on. And I think having a trauma-informed approach when we're working within the care sector enables us to give permission, gives us permission, shall I say, to be kind to others and ourselves, our colleagues and our friends, because all of us experience challenges and trauma in some way or form. So Stephen Covey said this: most people do not listen with the intent to understand, they listen with the intent to reply. And we need to come from a premise of, I need to understand, and this is the kind of message that we need to convey. So when we're looking at a trauma-informed practice, we're looking at a few things here. First and foremost, we need to create an environment for service users that creates safety and trustworthiness. So if I'm working with somebody who has issues around mental health, I'm aware of the disproportionality, the discrimination, and the institutional racism, I need to make sure my service creates a level of safety and trustworthiness, which means it's person-centered and it's built on relationship, not transactional. And I'll come and talk about that in closing. So also I've got to be mindful that the opportunity for choice and collaboration with people that I'm working with, have they got a voice in the service? Have they got a choice, or is it a service that is being done to them? Or is there an opportunity to collaborate? Is there an opportunity to see what options they have to receive a service that is better suited to them? Because more often than not, it's prescribed on them and it's very generic. And as you and I know, people are different and people need different services stroke solutions to their issues. And I think ultimately as well, we need to be coming from a strength-based and skill-based approach. So I need to be looking at their strengths, not looking at the false negative, which is the referral form, which highlights all the things that they've done wrong and all the problems that they have. And I don't see them as a whole person. If I'm not careful, I'll see them as a problem. And that's not healthy when we're looking at having a trauma-informed approach. The truth is we all go through stress. There's positive stress. Positive stress could be like me presenting today. I'm feeling slightly anxious, or, you know, if I've got a driving test, I might not feel, you know, I could feel slightly, you know, nervous about it. That's positive stress. That prepares me to maybe deliver or bring on my A game, for want of a better term. Tolerable stress is things that we all go through. You know, we may have heard some news recently about a loved one or someone we care for being diagnosed with COVID-19, for argument's sake, or some ill health. And these are things that as, you know, families or in communities, we can support one another. That's tolerable stress. When we're looking at toxic stress, we're looking at prolonged activation of stress responses in the absence of protective relationships. And this is key, because I think as a service providers and as professionals, what we want to be offering is protective factor. We want to be part of that protective factor. Within Spark to Life, we're very much around advocating for the service users. We want to be that bridge between them and the professionals to constructively challenge the system when we feel the system is either being disproportionate in its outworking of punishment, and focus more on rehabilitation. But what toxic stress that is prolonged does, it affects the frontal cortex of a young person or of an adult, and it means that they lack an ability to reason or make decisions clearly. Now, if I'm aware of this and I'm trauma informed and I'm trauma aware, it may mean I'll respond differently to somebody who's going through toxic stress. And there's a lot of great parents that are supporting children, but they're experiencing a lot of toxic stress. And we just need to be aware that it's a whole family approach when we're looking at addressing issues around mental ill health. There was a survey done in 1992, or a concept coined, that adverse childhood experience, and a questionnaire was birthed out of that. And because of time, I'm not going to go into that, but they looked at 10 at that time key indicators that would determine whether somebody has experienced adverse childhood experience. And this would come under physical abuse, emotional abuse, or sexual abuse. It would be neglect, physical or emotional neglect, and it would be mental illness, mother treated violently or husband, divorce, substance abuse, or incarcerated relative. If any of these things are happening within a family, a household, and a young person is brought up in that context, it is deemed that these are stress factors. These can be traumatic. And if 4 or more of these experiences happen, it raises the probability of that young person outworking symptoms that can affect their decision-making and their lifestyle choices. Some of the things we can add on to that now in 2020 is things like witnessing community violence, risk of homelessness, poverty, discrimination, bullying, long-term illness, loss of a caregiver, or natural disaster or war. And we heard from some of the testimonies in the video there at the beginning, and even myself working with young people that have migrated over here, or they may be first generation. There's a lot of people from our community that have experienced, whether it's that poverty, that homelessness, that bullying, the witnessing community violence, etc., even coming from natural disaster, that will add to their trauma. And that deeply distressing or disturbing experience, when compounded with issues of poverty or homelessness, can affect someone's mental health, that it can become a mental ill health. Because of time, I'm going to skip this. But what I do want to mention is there's some research done called epigenetics, and it talks about the genes that regulate our stress responses, and they can be altered by excessive stress, and the stress response becomes reset on high for life, promoting inflammation, and can lead to disease and ill health. Now, what's interesting, they determined epigenetics, or this whole concept, and it is evidence-based, around people that had gone through the Holocaust, and they looked at their generation or their family from one generation to the next. What's interesting with epigenetics is if you think of people that have gone through slavery, and we're only talking maybe our great-grandparents, and for some, our grandparents' generation away, that actually the continual stress that they had gone through generation after generation can affect someone's genes and can affect someone's mental health, emotional health, and physical well-being. And I think this is important when we're looking to advocate for our community, because there's a sense of injustice that has happened, and there needs to be some kind of restoration. So again, because of time, I won't go through this, but what I will say, and these slides will be available, is that it shows the probability when someone has 4 or more races of various different things, whether it's smoking cigarettes, alcohol, violence, crack cocaine, heroin. And again, this isn't anecdotal, this is evidence-based. It's been looked into. So if someone is cultural competent, and I believe as services we need to be definitely informed and aware around different cultures, different ethnicities that we're working with, and how we can best serve them, whether it's around the criminal justice system, stroke, their mental ill health, or the challenges that they have. There's a lot of people that we work with that may have been stabbed, they may carry a weapon, and sometimes people can ask the question, well, why are they doing that? But if, for instance, some of them will feel every day they leave their house, there is a threat or a fear of their life being taken. That's why some of them may use terminologies like it's like they're in a war. But the truth is, if you and I, when we leave this conference and we go about our daily business, we're not scared of going to the shop or traveling across a borough or across London. If that's what's happening to a young person, that is, they are experiencing traumatic, and for them to self-medicate, they may use drugs, they may get involved in risky relationships, risky behaviors, etc. And I think it's really important that we are mindful of those stress factors. Understanding faith as a discussion is really important, and the research identifies that faith for especially people from our community can become a protective factor. So that needs to stay on the table because otherwise we're doing a disservice to people's heritage and their wider family and their history. We need to be client-centered. So the starting point is not our worldview, it's their worldview. How do they see the world? What experiences have they gone through? It's not looking at the false negative, like I said, which is all the things that necessarily has been presented that they've done wrong in a referral form. It's working from a strength-based approach. And the system, we need to challenge it so it's not risk-averse and making decisions that are stopping someone's development or opportunities because they're making a decision based on risk, not based on a person-centered approach, not based on a strength-based approach. And holistically, we need to approach this holistically. Body, soul, and spirit, the whole person. We're not just looking at behavior modification. People will navigate the system with behavior modification. Whereas if we look at someone's beliefs, their beliefs determines their behavior. That determines how they outwork decisions in life. And barriers and concerns for BAME-led services are very much a recommendation from the Lamb Review is that they need to be funded and they need to be more integrated within statutory services. And last but not least, we can't be clinical or transactional. We need to be relational in our approach. And there's a lot of studies around people of color and the communities and how they better interact, not necessarily with a Western colonized kind of approach to relationships or to transactional interactions, but actually a lot more relational, a lot more community-based. My final quotes are, we think sometimes that poverty is only being hungry, naked, and homeless. The poverty of being unwanted, unloved, and uncared for is the greatest poverty, Mother Teresa said. Probably one of my heroes, Brian Stevenson, says this. He's a civil rights lawyer in the South of America fighting for justice for those on death row. And he said this, you can be properly convicted, but unfairly sentenced. And I think that would be my standpoint when we're looking at the criminal justice system. We're not trying to change people's convictions unless they are unfairly convicted, but often they can be unfairly sentenced or unfairly treated. I hope that's informative and helpful. And yeah, thank you. As I said, I'll make the slides available later.